Day-to-day life pressures and different events and experiences, according to health experts, are fueling mental health cases in the country. Recently, Uganda Counselling Association, in collaboration with Ministry of Health, released a report that shows that 14 million Ugandans are battling mental illness. This means that in every 100 people, 35 of them have mental health-related problems. According to World Health Organization, mental disorders are vary and present in different ways and characterized by a combination of abnormal thoughts, perceptions, emotions, and behavior. Brian Arenaitwe, a mental health expert, explains the major causes of mental health disorders.
One is background, as I have stated. Two is lack of enough sleep. You wake up at 5, go to work, and you don't get even what you want to get. Eventually you fail to sustain yourself. The brain can no longer accommodate your social life. You lose yourself. Then the background, some of these sicknesses are inherited within families. It is carried from generation to another generation. The other contributing factor is failure to manage social life. Like, for example, when we talk of employment, the people who are in employment domain, when you look at me and think I earn a lot of money, yet I do not earn, and my expenditure stretches my muscles, those are the people you meet talking alone on the street. They are not talking alone that you listen, and they are not even talking alone that they listen, but they are pouring out what they feel inside.
Indeed, when you take a walk on the streets of Kampala, your eyes will not miss a person with a mental disorder. UBC TV spoke to the Director of Public Health and Environment at Kampala Capital City Authority, Dr. Daniel Okello.
So the law says that a mental health practitioner may issue a community order, a community treatment order, and that means that someone has to be involuntarily taken to a facility where they can be able to take care of their mental health. So the law, yes, can give a provision for us because we own or we manage health facilities, but also relatives can be able to request for involuntary admission. That may be a spouse or any close relative who may be able to do that. So what I'm saying is that it is a role of both the community and also KCCA to take care of those who may have a mental illness. Mental illness is just like any other illness we suffer from.
But then to correct them is supposed to be a raw matter, which is supposed to be embedded in the policy of Ministry of Health, that as long as there is somebody who is seen twice or thrice on the street doing nothing and seem to show characters that are not fitting to the public normal domain, this person should be corrected and be taken.
Mental health experts now want government to come up with a strategy to tackle the major contributors of mental health disorders in the country. Uganda is ranked among the top 6 countries in Africa with the highest burden of mental disorders, with depression contributing 4.6% and anxiety 2.9%. Shaidat Nasaku, Adia Nakuti, UBC.